Hello. Welcome to Pharmadip. I hope you are finding my videos useful and fun learning. That's how it is. Easy to understand, easy to remember. Subscribe quickly and remain updated. Topic of this video is vaccination and immunization. Vaccination is nothing but treatment with a vaccine to produce immunity. Let's look into the types of immunity first. Active immunity, it is produced by individual own immune system, whereas passive immunity is an animal or human antibody and transferred. Active immunity is acquired by either an active disease that is antigen or through vaccination, either live, attenuated or inactivated. Passive immunity is acquired through antibody or immunoglobulins. Now, what role does passive immunity play? As prophylaxis therapy, varicella-zoster immunoglobulin, VZIG, it is given to patients with leukemia or reduced immunity who are exposed to varicella-zoster. Passive immunity is also used for treatment of antibody deficiency. That is, in primary immunodeficiency or as chronic lymphocytic leukemia, patients must be given intravenous immunoglobulin or intramuscular immunoglobulin every 2 to 4 weeks to maintain immunity. The other important role it plays is in prophylaxis of infectious disease through tetanus immunoglobulin and hepatitis B immunoglobulin. Now let's look a little deeper into its role. When tetanus immunoglobulin is given for minor wounds with unknown history of infectious disease, TD, that is, tetanus vaccine is given. For known history, if the last TD dose is received within 10 years, then it requires no treatment. But if last TD dose was received more than 10 years ago, then TD is only given. That was for minor wounds. 10 represents the number of years of validity. Like TD is valid for 10 years for minor wounds. Now let's look for major wounds. For major wounds, both tetanus vaccine and immunoglobulin both are given. That is TD as well as TIG. Here also for unknown history, TD and TIG. Whereas for known history, if the last TD dose was received within 5 years, then no treatment required. However, if last TD dose received more than 5 years ago, then both TD and TIG should be given. Here the validity is 5 years. That was for tetanus immunoglobulin. Now let's look into hepatitis B immunoglobulin HBIG. IG represents immunoglobulin. If a pregnant woman has hepatitis B when she delivers the baby, she must be given hepatitis B vaccine plus hepatitis B immunoglobulin. Also, if a nurse is infected with hepatitis B patient blood, then she must be given hepatitis B vaccine and hepatitis B immunoglobulin as well. However, both of them should be administered at different body sites. Types of vaccines: live, attenuated vaccines, and inactivated vaccines. Live vaccines are produced by modifying the virus or bacteria to give immunity, whereas inactivated vaccines are produced by fraction of the virus or the bacteria, such as cell wall polysaccharides. Regarding disease, live vaccines do not produce disease but can and are not given in immunocompromised patients, whereas inactivated vaccines are unable to produce disease and can be given in immunocompromised individuals. Live vaccines reduce virulence of pathogen by attenuation. Attenuated means weakened but still live or viable. Live vaccines, generally, provide lifelong immunity. Now let's look at live attenuated vaccines. The best way to remember is an abbreviation. Yellow Rome in best place. It's easy to remember and recollect. Yellow, Y stands for yellow fever. Rome here, R stands for rubella and rota. O stands for oral polio and oral typhoid. M stands for measles and mumps. E stands for epidemic typhus. IN stands for influenza, that is live attenuated influenza vaccine. B of best stands for BCG. P of place stands for plague. Other live vaccines include varicella, zoster, ZVL, smallpox, and chickenpox vaccine. Key points to remember while administering the vaccine types. This is important part, so keep focus on it. Live vaccine and inactivated vaccine both can be given at the same time on the same day or can be given separated without regard to the spacing. Inactivated vaccine plus another inactivated vaccine. It can be given at the same time on the same day or can be given separated without regard to the spacing. However, when two live vaccines are given, that is live vaccine plus live vaccine, they must be given at the same time on the same day, and if separated, the spacing must be 28 days between the two vaccines. Live vaccine plus antibodies must also be separated. They should not be given at the same time. Vaccine storage. Most vaccines require refrigeration 2 to 8 degrees Celsius. Zostavax required to be frozen temperature less than or equal -15 degrees Celsius. MMR can be stored in refrigerator or freezer or bottom shelf of refrigerator. Now let's look at the temperature of vaccine required to be stable. Tetanus vaccine stability is 1 hour. It should be stored at 2 to 8 degrees Celsius. MCV stability is 3 hours and stored at temperature 2 to 8 degrees Celsius, and most important, it should be protect from light. OPV stability is 3 hours stored at -20 degrees Celsius. BCG stability is 4 hours stored at 2 to 8 degrees Celsius and should be protected from light. Highlights. Protect from light are MCV, BCG, measles vaccines. OPV after opening can be kept at 2 to 8 degrees Celsius for 6 months. Vaccines administration routes. Majority are intramuscular only except intramuscular or subcutaneous IPV inactivated polio vaccine, PPSV pneumococcal polysaccharide vaccine. Subcutaneous only are MMR, varicella, and Zostavax. Orally administered are OPV oral polio vaccine and RV rotavirus vaccine. Vaccination and pregnancy. Vaccines given in pregnancy are TDAP, during each pregnancy, ideally between 27-36 weeks gestation, that is last 3 months. And IIV inactivated influenza vaccine, give immunity to child during pregnancy and 6 months after birth. Vaccines contraindicated in pregnancy are HPV, MMR, varicella, ZVL, BCG, and LAIV. In addition to these, all live vaccines are contraindicated. It is important to note that pregnant woman is more liable for influenza complications. Now let's look at considerations while administering antibiotics with vaccines. Some vaccines may contain small amount of certain antibiotics such as neomycin, streptomycin, gentamicin, polymyxin B to prevent bacterial contamination during manufacture process. Vaccines such as MMR, IPV, ZVL. Patients with allergy to these antibiotics must not be given these vaccines. Vaccination and egg allergy. The following vaccines may contain traces of egg proteins. MMR. Influenza vaccine egg allergy with just hives, then take the vaccine. Egg allergy with angioedema, respiratory distress, light headache, recurrent emesis, or who require epinephrine or emergency medical intervention, then vaccine is given under supervision of a healthcare provider who is able to manage severe allergy. Yellow fever vaccine contain higher amounts of egg proteins, so allergy specialist is recommended before vaccination. Vaccinations before Hajj are annual influenza flu vaccination. MCV, meningococcal, in addition to these polio plus corona and Zika vaccine is also recommended. Adverse effects of vaccines are injection site reactions such as pain, swelling, erythema, or redness are major side effects. Fever. It is important to monitor patients for at least 15 minutes following administration. Severe allergy is handled with epinephrine, diphenhydramine, and CPR. Let's know the contraindications of vaccines, that is, in which cases it should be avoided. Live vaccines are contraindicated in pregnancy, and live vaccines in immunocompromised patients. Immunocompromised individuals include patient receiving cancer chemotherapy. Live vaccines can be given after chemotherapy has been discontinued for at least 3 months. Patient with recent hematopoietic cell transplant, HCT. Patients receiving biologic agents, TNF inhibitors, rituximab, etanercept. All vaccines are contraindicated in patients with CD4 count less than 200 cells per millimeter cube. Patients receiving daily corticosteroids, all vaccines causing severe allergy, anaphylactic shock, are contraindicated. All vaccines in moderate to severe illness with or without fever are given with caution but not contraindicated. Now, few key considerations in special population. These are few important points we need to remember. In case of children with preterm birth, we should immunize based on chronological base, do not reduce the recommended dose, and delay hepatitis B vaccine until the baby is either more than 2 kilograms body weight or more than 30 days old. Whereas consideration in patients receiving corticosteroids include live vaccines may be administered to patients receiving the following: topical steroids of any dose, live vaccines given immediately. Systemic steroids less than 2 mg per kg per day, low or moderate dose, live vaccines given immediately. However, if the dose is more than or equal to 2 mg per kg per day for less than 14 days, then live vaccines given immediately. If the dose is more than 2 mg per kg per day for more than 14 days, then live vaccines should be delayed at least 1 month after stopping the steroid. Quick recap. If patient receiving topical steroids of any dose and systemic steroid of dose less than 2 mg per kg per day, also if the dose is more than 2 mg per kg per day but less than 14 days, then live vaccine is given immediately. However, if the same dose is given for more than 14 days, then vaccine should be given at least 1 month after stopping the steroid. I hope you got some valuable and easy to remember information in this video. In the next video of Vaccination Part 2, we will look into some important vaccines and consideration as well as vaccination schedule or guidelines. The Part 3 of this video will have Q and a session that will help you analyze how much you have understood. If you are finding my videos useful, then subscribe quickly and give a big thumbs up. Share with your friends and colleagues. Do visit my website www.pharmadip.com. You can also follow me on Instagram, Facebook, and LinkedIn to get more information.